Hi, I'm Student Inclination Joel Carrion. What's your name?
Hector.
Hi, Hector. So today we're going to be performing some neurological evaluations. Okay, so the differential diagnosis for this case is multiple sclerosis and pernicious anemia. Things I will inspect before starting my exam will be gait, ambulation, if it has an antalgic lean to one side or the other. Also going to be looking at motor neuron evaluation on his body or his facial expressions. Okay, so the first test we're going to be doing is it's going to be direct light reflex. So I'm going to be using this light on your eye. Is that okay? I'm going to be flashing. Can you look that side? I'm going to be flashing one eye. Okay, so that's direct light reflex. I'm going to do it bilaterally. So for this one, I'm looking for an ipsilateral eye constriction when I'm putting the light on his eye. For this one, the sensory is cranial nerve 2 and the motor is cranial nerve 3, and the integration in the brain is the midbrain. Now we're going to be doing indirect light reflex, so I'm going to flash one eye and I'm looking for a response on the contralateral eye, which is dilation on the contralateral eye. So for this one, it's going to be cranial nerve 2 on the side I'm doing the light, and cranial nerve 3 on the opposite side. And the integrating for this is also the midbrain. Now we're going to be doing accommodation reflex. So for this one, I need you to look forward. Can you look here? Okay, you're going to keep looking at this and I'm going to bring it closer to you, okay? Okay, good. So for that, I'm looking for the eyes to converge together. So for this one, both cranial nerve 2 and cranial nerve 3, and the integrating center is the occipital lobe. Now we're going to do the jaw jerk reflex. So this is my reflex hammer. I'm going to be using you to test on your jaw. Is that okay? I'm going to you relax your jaw. Okay, good. For here, I'm looking for a response or deviation to either side. This is a deep tendon reflex, and it's integrating cranial nerve 5 or trigeminal nerve, and also is sensory and motor. And the integrating center is the pons. Now for our next test that we're gonna do. Okay, we're gonna be evaluating for facial expressions. So, can you raise your eyebrows? Can you close your eyes tightly? Can you show your teeth? Open your eyes and show your teeth. You're gonna relax your eyes. Show your teeth. Okay, puff your cheeks like this. Okay, good. Smile. And frown. Frown like this. Okay, so I'm here evaluating for the muscles of the facial expressions. Any abnormal response, we can conclude that it has a problem in the facial expression muscles and the nerves integrating that. Okay, our next test, we're going to be evaluating the function of the soft palate. So you can open your mouth, stick your tongue out and say ah. Okay, good. So for here, I'm evaluating if there's any depression of the tongue. I'm watching for also symmetrical or asymmetrical rising of the soft palate. And if there's unilateral paralysis, one side of the palate does not rise in the uvula, this will deviate to the normal side, not to the affected side. Okay, so the nerves associated with this particular test is the glossopharyngeal nerve and the vagus nerve. Okay, now we're going to evaluate for cranial nerve 8. So we're going to need you to stick your tongue up. I'm going to be looking for any atrophy, fasciculations, or deviation. A protruded trunk deviates usually to the involved side. Okay, now the Fakura test. So for this one, you need to stand up. Okay, and I'm gonna be, you're gonna close your eyes whenever I tell you, and you're gonna start marching. I'm gonna be holding here just in case. Okay, close your eyes and start marching with your hands as well. Okay, good. Okay, here I will be looking for any unbalance or uncoordination or hesitation on the patient, which will indicate a vestibular nerve lesion. Okay, our next test will be finger to nose test. You can sit down. Okay, so with this test, I need you to, I'm gonna put my hand in a position. You're going to touch your nose with your finger and try to touch the point of my finger. Okay, you touch your nose, touch my finger. Do it again, as fast as you can. Close your eyes. Okay, good. Open your eyes. Try to try it again one more time here. Close your eyes. Okay, good. So for this test, we're also looking for coordination. We're testing proprioception and the cerebellum. A positive would be slow hesitation or inability to do it. We also have to be conscious that if it's maybe the first time for the patient doing this, they could be a little bit confused. So not confuse the patient confusion with a positive result of the test. Okay, so now we're going to be doing Huffman test. So for this one, I'm going to grab your hand. I'm going to be flicking your fingers. Okay, so here, if there's any abduction of the tongue when I'm flexing the fingers, it can mean that there's an upper neuron lesion in the spinal cord or the brain. Okay, now we're going to be doing plantar reflex and Babinski sign. So for this one, I'm going to need you to go facing up for me. Okay, I'm going to be using the sharp part of my reflex hammer. This feels like this. It's going to feel a little bit uncomfortable, but we'll get through it. Just let me know. Okay, so for this one, I'm going to use this part and do a slight semicircular motion on the patient. So our normal response will be that the patient could flex their fingers a little bit, their toes a little bit. So we'll do it here, there. So an abnormal response for this is that the patient will abduct their toes and have some slightly pain, which could indicate a lower motor neuron lesion. We have to also be conscious here that this feels a little bit awkward in the patient and not confuse a response like that to an abnormal response. So we will retest again after. Okay, we're also going to be doing, there's also other ways to do Babinski sign. Well, in this particular test, we're going to be using this. Okay, so thank you very much, Hector. We're all done.